Hi everyone, Patricia Worby, Alchemy Therapies, and just a small video today on eye movement desensitization and reprocessing, or EMDR for short. Now, I've done a few videos on this, just introducing it, what it is, what it does. I just want to recap a little bit of that and update you with some of the exciting things that I've discovered it works for recently. So EMDR started in around about 1988, where it was sort of discovered by a woman called Francine Shiro, who was a psychologist, and she was going through her own trauma at the time, having been diagnosed with breast cancer. And what she noticed was that going to the woods and having her eyes flicker over different things took a lot of the trauma and pain of that diagnosis away. Like, she wasn't so anxious, she wasn't so worried about it. And being a psychologist and being curious by nature, she went back and she decided to experiment with eye movement, and she developed a protocol which she used in her family with great success to resolve all manner of traumatic memories. So you can use it on PTSD, post-traumatic stress disorder, people who've been in war situations, bombings, accidents, anything really traumatic. It works really well on single-issue trauma, as we like to call it. And that's really what it's licensed for, therapeutically. But I use it in all manner of other ways, and I found it's particularly good with birth trauma. Now, birth trauma is something that you may or may not have. If you were induced, if you were late or early, if there was some sort of medical intervention in the birth, then it's very likely you have birth trauma. Now, what that actually means is a sort of stored memory of distress by the body, and it's stored in a place called the limbic system, which is your emotional brain, which is the back of your brain. It's nothing to do with your thinking brain, so it's not a thought process. It's actually not cognitive at all. It's a sensory process and a sensory memory of distress, which may manifest in all manner of ways, as palpitations, difficulties with swallowing or reflexes, facial tics, over salivation. I'm trying to think of, there's so many different things because they're all controlled by the autonomic nervous system. Or bedwetting, difficulties with urination generally, or any form of bodily function which doesn't work according to how it should do. So it's a very wide range of issues, and it can also cause anxiety, of course, because anxiety is the sort of over top layer to unresolved emotional conflicts within the body. So people who have unexplained anxiety often have this early experience of trauma, and it can be during the birth itself, it can be prior to the birth if mother was stressed, and it can be immediately after birth if mother is depressed or she's having difficulties herself where she needs surgical intervention, and therefore the baby is separated from mother for any length of time. Because what is supposed to happen and what our bodies are designed to accommodate is to be cuddled and nurtured and suckled when we're very, very young. Within hours of birth, we should be connected to mother. And if that doesn't happen for whatever reason, our body records it as a conflict or a trauma, because it's actually a threat to survival. Now, the limbic brain is all about survival. It controls threat response, the stress response in the body, preparing you for action to protect yourself. But it's basically all about survival. So if you are threatened with loss of connection for a baby, that means death. Because without a mother to care for you when you're very, very young, you're going to starve and die. And so these very ancient responses are coded in a very, very strong way. And so they persist even through growing up and becoming an adult. And as I've said, they show themselves in really peculiar ways, which, are generally called medically unexplained symptoms. And that's because medicine doesn't understand the psychology of trauma, because it doesn't deal with anything that happens in the brain, really. there's this, what we call the Cartesian split, which came 200 or 300 years ago, where medicine took the body and the church took the mind, until psychology took over about 100 years ago. So, so we've got a lack of understanding in the medical profession of how important the autonomic nervous system is and how it connects to the back brain and these survival instincts. Now, what I promised I was going to tell you was how I've used the EMDR in this way to help resolve these conflicts. So what I did last week, 2 different people actually, because once you've done it once, you're excited to try it again, was I took somebody back to their birth. And now this is known about in hypnotherapy. You can do it with a technique called regression. And you just, there are various ways you can do it, but you basically get them to imagine they're going backwards in time, and then you take them to that first experience. With EMDR, because the client was already very willing and that's what he wanted to work on, I didn't do a formal regression, as it's called. I just asked him to just concentrate on the feelings in his body, and then we did the familiar EMDR movements. And that's moving the fingers from left to right across your vision. And what the client is supposed to do is follow that left and right movement with their eyes only. So they avoid moving their head because we want the maximum eye movement. And what eye movement does is it accesses memory centers in the hippocampus and also in the limbic brain, in particular the amygdala, which is your stress response initiator. It's a sort of threat or smoke alarm style, tiny almond shaped, there are 2 of them actually, organs in the middle of your brain. And once they perceive threat, if the threat is significant to life, it will be stored as a traumatic memory, not as a regular memory, because it needs to be accessible for the rest of your life should something similar happen, so that you can avoid and escape it. But tends to happen is it just keeps triggering responses in the adult over and over again, so it's never over. So anyway, so you can use these eye movements to access that sensation and allow it to be moved from your stress center, your trauma center, into properly the processing part of your brain, which is the hippocampus, which then allows the memory to be assimilated, to be metabolized, to be known by the brain as in the past and not in the present. And that's so important for feeling good about yourself, feeling connected to your body, and a lot of these unresolved symptoms simply melt away. Now, it's not a panacea for everything. It doesn't disappear immediately. You need to do several sessions. You need to really, really resolve the issues. But what I can tell you is we took my client back to a state of being which he doesn't even recall. He cannot remember being born, but his body does. And that's why it's so fascinating to work with. As a clinician, what you're observing are movements of the eyes, not the left to right, because that's happening automatically as they follow your fingers, but jumps in between, so that the eyes actually jump, the pupils seem to jump. And that's usually where a memory is coming in and it's being processed. And so a good clinician will stop the client at that point and say, where are you now? What's going on? And the client will tell you. Following the clues, of course, is the skill, and enabling the client to sort of follow it as well. Because when they start to follow what's happening in their body, their cognitive brain starts to connect with the middle brain or back brain. And so you start to get brain integration. And this is where you start to feel like you're okay, your body is safe, all is well in the world, and you're not stuck reacting in ways that were programmed for in your childhood. There's a lot of trauma that comes along in your childhood. And so just following my client and noticing little ticks and quirks of what was happening to him, his neck's being stretched or his eyebrows rising, which is usually a sign of shock. That's a standard reaction, isn't it, for all of us when we see something or feel something that we find overwhelming, is to go like this. Okay, so little things like that. There are often tics in the face, particularly around the jaw, which is fear, usually rage as well. Although rage is held in the jaws. If you're a teeth blinder at night, you'll probably unresolved anger. Now, I know a lot of this sounds very strange indeed if you come from the regular medical model. And believe you me, I never believed it until I did it myself and then have trained in it and done it with other people. What's amazing about EMDR is it can resolve in an hour or an hour and a half issues that have been with you for the whole of your life. And yes, I'm not saying you can resolve every issue. You have to work on each one specifically and quite systematically to become fully whole. But that is what it does to you. And to find out that I can actually take someone back to a time that they don't have any conscious memory of is so fascinating. You can do it with all sorts of issues, memories of operations. That was the next one I did. Seeing someone go through an operation that she had, which again, she was under anaesthetic, so consciously she has no memory of it. When your conscious brain is offline through anaesthetic, your back brain is still recording every single thing. And so injections, surgery involving cutting, all perceived by the back brain and memorized. So you can actually track someone through procedures and enable them to resolve that. So look, if that sounds like you, if you've got an issue with any of these things, and you would like to explore using EMDR in my particular way, because I have a particular protocol that I've developed and I follow, do get in touch. And don't suffer with pain or dysfunction. Do get help, because it is readily resolvable these days. We're being given these amazing tools, and I'm so excited to be using them. So great, thanks for listening. Do sign up, by the way. I'm on my website. I've now got courses that I'm running online. One that I've just developed is attachment attunement and finding the authentic self, and that's what I'm very excited to teach people, is that once you learn about these attachment wounds, these failures to attach properly to your caregivers, usually mum and dad, in the early years, has profound implications for you and the rest of your life and relationships with other people. But it's all resolvable. And using EMDR, tapping, paving, various other body-based techniques can actually help you to change the way your brain works. And so you actually come into alignment with your true self, your authentic self. So very excited to introduce you to that, and looking forward to hearing your comments. Thanks. Bye for now.